Hello and welcome to the next instalment of our A to Z for general podiatric conditions and complaints, and make sure to look out for NK Sports Podiatry's A to Z of MSK podiatric conditions. Now today is the turn of N for nails, and nails are something I deal with day in, day out. And I often get asked by people if I can get a general indication of their health from their nails. And in a lot of cases, you can get some idea from people's nails. And those people coming in with ingrown toenails, be warned, we can tell if you are a picker or a cutter. But generally we look at different colours of the nails to get an indicator of any problems there. And the most common colour we see is the yellowish brownish discoloration that you get with a fungal nail infection. Now that doesn't mean you have any health problems. A large number of the population have fungal nail infections, but it is what we see most commonly. Now, white discoloration, if it's little spots around the nail, that can be a fungal nail infection as well, and it can also be damage due to nail polish. A general yellow colour of the nail can be a sign of problems though. It can be a sign of thyroid problems or lung problems, diabetes, psoriasis, lymphedema, or even rheumatoid arthritis. And if you have a general white colour over the whole nail, that can also indicate problems like liver problems, hepatitis, even heart failure or kidney problems. Now generally if we're seeing a blue coloration over the nail, that is an indicator of a lack of oxygen in the blood. So that can be lung problems, emphysema, COPD, or even a peripheral vascular disease, so a circulatory problem. Now, if you've got dark streak, I spoke about this last time, it can be an indicator of a melanoma, and that is essential to get checked out if you have a dark streak in your nail. Now, any horizontal lines, so the lines that go across the nail there, they are an indicator generally of interrupted growth, and that can be due to trauma, illness, even malnutrition, and chemotherapy we see it a lot with. It can also be a sign of diabetes or again peripheral vascular disease which interrupt the growth. If you see pitting of the nail, little dips in the nail, that is normally an indicator of psoriasis or an inflammatory arthritis like psoriatic arthritis. Spooning of the nail, where the nail kind of dips and comes up again, and now that is usually an indicator of anemia, so that probably should get checked out. And clubbing of the nail, where it comes over and back down on itself, that can be quite serious. That can be an indicator of lung cancer or heart disease or a chronic lung infection. Now it can also be a sign of an inflammatory bowel disease or even hereditary, but it should also be checked out. You can get something called Terry's nails, which is where you get a darker band across the tip of the nail there, so just behind the white you get a darker band, and that can be a sign of congestive heart failure, diabetes or liver disease. And there are many other nail indicators that we can look for that may or may not indicate any health problems. So the main thing here is do not panic. Sometimes nails just do funny things, usually in response to some trauma at some point. But if you have anything going on with your nails that concern you, they're starting to look a bit funny, they've changed, they're going a different colour, it is always best to get an appointment with your local podiatrist and get them checked out, and just make sure there is nothing else going on there. So I hope that's been helpful. If you have any questions or comments, put them down below and I'll get back to you. And any suggestions for any other videos, please leave them in the comments. Bye bye.